Often patients ask what to expect on the day of surgery when we're doing facial rejuvenation or a facelift. So again, one of the nice things we have is we have our own private ambulatory surgery center. So the experience is very nice, again, similar to checking into a boutique hotel where everybody knows your name. We have multiple doctors, of course myself, anesthesiologists, we have multiple RNs, multiple scrub techs, and other people that are all there exclusively for the patient. Because facelift is a slightly longer surgery than, say, rhinoplasty or some of the other surgeries I do, often it's the only surgery I'm going to do that day. So the one patient has everybody and the entire facility just for them. So people will come in generally about an hour to an hour and a half before surgery. We do some preoperative preparation. The anesthesiologist or the nurse will start an IV, which is probably the one unpleasant experience for approximately 5 seconds. But once we have that IV in, we can put in some medication that can actually make it all go away. Patients come back, they walk back into the operating room with the nurse, with the anesthesiologist, sit in a nice comfortable bed, and we do a very, very smooth induction of anesthesia. Often patients don't even realize the time lapse between when they're going under and when they wake up in the recovery room. It seems like only about 10 seconds passed, when in reality perhaps 4 hours passed. And that just goes to show how smooth everything is. When people wake up from a facelift, generally we have their face wrapped with some gauze just to apply a little bit of light pressure, mainly to prevent bleeding. And that combined with our surgical technique where we really respect the planes of the face and we are very precise in how we operate, we don't need drains. And that is one of the advantages of having a facelift done in this precise and very well executed manner. People will of course have stitches around the ear, sometimes some stitches underneath the chin when we're working in the neck area, and then this gauze area around their face. If we're doing eyelid surgery, often there'll be some one long running stitch both below and above the eye in the eyelid area. So actually really not a lot of bruising, maybe some slight degree of swelling. People will go home or they can stay overnight with the nurse. One of the things with facelift is because it's a longer surgery, and if we're doing a lot of procedures, for example, sometimes what we call the blue plate special, we're doing a brow lift, we're doing eyes, we're doing facelift, we're doing chin liposuction. Sometimes the anesthesia can last 6 hours, maybe even slightly longer. When that happens, there may not be enough time for the body to get rid of all the anesthetic, and sometimes it's safer to stay overnight. But often people can go home, they can stay overnight with the nurse, or go home with a private duty nurse. We actually prefer the latter if somebody is going to have a nurse, because I think people heal the best in their own bed. And quite frankly, the wrap is there, there's no drains, there's actually no need for any sort of specialty nursing care, just somebody who can take care of you and pamper you during the first night. We often have out-of-town patients that come in. Often we'll say, hey, maybe you can stay in a nearby hotel overnight, and if everything's fine in the morning, you can go ahead and head out and go home. So often after a facelift, the dressing is taken off by the patient, and by the dressing I mean the wrap around the head, after 1 full day after surgery. So easy enough, it's just a little snip down here and it comes off like a motorcycle helmet, and then patients can go ahead and do very simple wound care, which is put a little bit of Vaseline or Aquaphor on the incision sites, maybe some cold compresses on the face, keep the head up, and that's really about it. When we do eyes, maybe moisturize the eyeballs with some artificial tears and maybe some artificial tear gels that people can freely find in the eye care section of their local pharmacy. Again, just like other surgeries, generally the second or third day is the day where we get maximal swelling and bruising, and after that, people turn the corner. And usually it's about 7 or 10 more days and we reach 90% recovery. So it's not like the old days where you have to take a month off and, you know, go rent a beach house somewhere away from where everybody knows you. Recovery is very quick. 1 week, 1.5 weeks, and you're back to being publicly presentable with a little bit of judicious use of makeup. So the recovery process is very predictable, a lot shorter than people think, and gets you to where you want to be generally within 2 weeks.